Well, so much do they want this to be electronic records that they're actually giving doctors $40,000 a piece to change their office to electronic records, but then they also want access to those electronic records. So it does concern me about patient privacy, and I don't really want the government looking at my records or any other patient records. I think it's a real danger. I was in the state capitol today, though, talking about trying to get our Attorney General in Kentucky to join the lawsuit against this, and we had 300 people there, and it's part of this Tea Party movement. People are not happy, but there's still great momentum out there in the countryside to try to change this.
What does the financial community think about this? I mean, do they think that this is a left-wing politics run amok?
You know, it's funny.
Or do they think there's a way for this to work?
We've been talking all day about Jamie Dimon coming out and saying that we were sick of being demonized by the federal government, by some of the bureaucrats in Washington. Listen, Wall Street supported Obama in a major way.
Right.
Unprecedented. Goldman Sachs
that was then.
That was 4 times more to McCain, to Obama than they gave to McCain-Palin.
Right.
Right now, they are really worried, and it's not just the rhetoric. They are worried that, you know, instead of reforming health care, we've created a new entitlement. Instead of maybe helping the people at the bottom end of the ladder, well, you know, we're redistributing wealth. They are really worried about what this does to the deficit. They may not go public with it, but you could talk to every single Wall Street CEO, and they can't believe he turned to this instead of deficit reduction.
Aren't you worried as a patient advocate that innocent human beings, whether they're healthy 20-year-olds or 75-year-olds who need to see a physician more regularly, will be powerless here? There is a clause in here that prohibits an appeal from a decision of a bureaucrat. So if a bureaucrat says to Dr. Paul, you may only perform this service on this patient, that decision is final and absolute.
Right. And doctors will be constantly forced to choose between doing what's right for their patients and avoiding a government penalty. You know, women's rights advocates who have fought for 30 or 40 years for a woman's right to choose on reproductive issues and a woman's right to keep her medical records private need to reassess the impact of this law on their values, because whether you're pro-life or pro-choice, you lose under Obamacare.
Dr. Paul, can you bring yourself to put down in the government laptop everything your patients tell you and wait for the government to come back and say, okay, doctor, we've decided that this is the procedure, this is the medicine, and this is the budget?
Yeah, no, and being a physician is really not about following an allogram and everything is out of a cookbook. I think there is some intelligent interaction, and the choice is not always the same as what comes out of a book. So I don't think that's the way we want to practice medicine. Talking about the cost, you know, the Congressional Budget Office said that the prescription drug plan would only cost $400 billion. It's costing $1 trillion. The implications of this, they say they're going to have $500 billion in savings from Medicare, but it's based on assumptions that Congress gave to them. It's not based on reality, and when you make something free, it gets overutilized, and that's what will happen here. It'll cost 2 and 3 times as much as they say it will cost.
And there's this crazy thing in there, Charlie, about the Reserve Corps, the 6,000-person group.
I don't even know what to make of that
the president can put together. He can conscript doctors from the state National Guard and make them work for the federal government.
He's bringing back the draft.
He almost is bringing it back.
I
mean, where is that going to go? Are we going to get to a system like Great Britain where the healthcare providers are employees of the government?
That's what it looks like. I mean, we're at least moving in that direction. Obviously, there's going to be a fight over this. What I don't understand, and maybe the doctor can explain this, how did the AMA ever support this nonsense?
That's shocking, but remember that only 17% of physicians belong to the AMA, and many of them are not physicians who actually care for patients.
What physicians in their right minds could support this, Dr. Paul?
Right. And I think this actually will lower their membership. The AMA has been struggling for years, and they do not represent doctors across the country. And AAPS has been growing dramatically as doctors who want to fight against big government join together under a different banner. But the AMA doesn't represent me. I've never been a member of the AMA, and they don't represent my position in supporting Obamacare.
Do federal judges have the moral courage and fortitude to look at this thing and say, this did not come from the Constitution.
I believe they will. And in fact, there's a very important case, Gonzalez versus Oregon, which was just decided a couple of years ago, that made it very clear that the federal government does not have the power to regulate the practice of medicine or impose medical standards and regulate how doctors treat patients.
Dr. Ron Paul, former Lieutenant Governor Betsy Coy, my colleague Charlie Gasparino, thanks for joining us. It's Census Day. The government says you must answer a bunch of questions about what does the Constitution require? We'll be right back.